My dear audience, welcome to 2021 World Intellectual Property Forum. I'm the moderator, Professor Mei Hsin Wang from National University of Science and Technology. Currently, I'm the fellow of Royal Society of Chemistry UK. With over decades international pharmaceutical company experience, that's why I'm here for this panel titled COVID-19 Medical IP Landscape, Western Medicine versus Traditional Chinese Therapy. In order to success in combat of COVID-19, the integrated treatment combining the benefits from Western medicine and traditional Chinese therapy could be the comprehensive approach. In this panel, the IP landscape will be introduced by Professor Yuan Keng, while the traditional Chinese therapy to improve the immune will be stated by Dr. Yuelong Yang. Thereafter, the good manufacturer practice enforcement to standardize the quality and proven efficacy on Chinese traditional medicine will be introduced by Professor Yixin Lin. Nevertheless, the guideline and principal treatment to deal with anxiety during COVID-19 pandemic will be elaborated by Dr. Hung-Chieh Wu Zhang. Panel discussion and introduction of COVID-19 and IP landscape will be handled by me, with the aim to provide audience a cutting-edge view on IP development for COVID-19 treatment worldwide, based on Western and traditional Chinese medicine, from contribution of Chinese clinical medicine, and look forward to the merits generated from both Chinese medicine and Western medicine for the much better synergy effect. After the Western and the Chinese therapies for COVID-19, we believe the quarantine due to the COVID-19, the pandemic, have caused anxiety for a lot of people. Therefore, we're very honored to have Dr. Wu张弘杰from National Taiwan University Hospital Yunlin branch to share his professional view how to deal with anxiety due to COVID-19 pandemic and under the quarantine. Dr. Wu Zhang, please.
Thank you. COVID-19 may damage the brain, which leads to delirium or psychosis. However, it is impossible to clearly distinguish the condition when it just happened. Some recent small-scale studies have found that COVID-19 may be related to some recent onset of schizophrenia. A British study indicated that the impact of COVID-19 on cerebral blood vessels is more for the senior people than the younger population. The elderly people often develop delirium before the respiratory symptoms appeared. Because the elderly themselves are more likely to develop comorbidity, the progress poorly. Nevertheless, the senior people are prone to suffer from depression and anxiety in their mental states. There are plenty of reasons to make the senior population more vulnerable, other than social distance, that older people usually are majorly standing at home care. They are often with limited information and skills to cope with environmental disasters, such as pandemic, which can aggravate depression and anxiety. Not to mention, the quarantine can increase the severity of paranoia for the elderly. Therefore, in the overall environment, it is recommended to help patients with remote treatment through telephone, internet, and video conference, and so on. Under safe circumstances, medical practitioners may allow to visit some communities for public education If patients suffer from psychiatric symptoms, while prescribing the psychotropic medicines, it is suggested to avoid drugs that will affect cognitive function and cause delirium, such as BDD, benzodiazepines, or anticholinergics. Nevertheless, due to brain damage caused by COVID-19, which may lead to thrombosis, therefore, medication should also take into account to avoid the consequence of thrombosis. Furthermore, drug-drug interaction should always to be reminded while treating COVID-19 patients with multiple medications. Above all the information, I would like to share with the audience how to deal with possible anxiety. During COVID-19 quarantine, nevertheless, some reminding points to be careful when dealing with senior people for medication during the COVID-19 pandemic. Thank you for your attention. If there is a question, I am more than happy to answer.
Thank you very much for Dr. Wu-Chang very comprehensive sharing. I believe audience must have learned a great deal how to cope with COVID-19 and take care of their health. And hope we will soon pass through this tragic period due to COVID-19. We would like to answer questions from the audience. If you would like to raise your question, please pass your message to us. Thank you very much. Thank you, Dr. Wu-Chang.
Thank you.
Nevertheless, we would like to thank all the eminent speakers in this panel and all the audience, your participation. It has been a very meaningful panel for us to learn how to deal with COVID-19 through Western medicine and Chinese medicine. If the audience have the question to ask, speakers will be very happy to answer you.